Through collaboration efforts online, Wikipedia has always been at the forefront of providing information to the public on almost any type of topic, including a pandemic. COVID-19 has been one of the most relevant topics of 2020 and still remains so right now. So, gathering information as much as possible is essential for the world to help combat the virus. Many health sources online provide knowledge and resources, but false information can be extremely problematic, especially when dealing with numbers concerning people's health. So our hypothesis is that we expect Wikipedia to be a better source for information related to the COVID-19 pandemic because it is quick and provides general information that people are looking for compared to other sources that are more well known. So the sources that we're going to compare Wikipedia to are Johns Hopkins and the World Health Organization. Compared to Wikipedia, Johns Hopkins is a private research university, and the World Health Organization is an agency of the United Nations that specifically deals with this kind of information. So both of those are more well-known and accepted sources compared to an online community. Here you can see a screenshot from February 21st on each of the sources, and Wikipedia and Johns Hopkins both have the same numbers, whereas the World Health Organization is not as up to date as Wikipedia and Johns Hopkins. And a Google search of the COVID-19 pandemic, there was an overestimate of the number of deaths on Google.
So for our data sources, the main focus of this project was to look at specifically Wikipedia by exploring the page views and edit history to see what details it would show us. And in order to find the most relevant articles, we use Wikipedia text and citation data. We specifically looked at articles with titles that contain the word coronavirus or COVID-19 or something related to the coronavirus that would give us relevant articles. And we pulled, in addition to Wikipedia, we also pulled information from the World Health Organization and Johns Hopkins websites themselves. So taking a look at the coronavirus 2020 page, we performed an EDA, and initially we can see that most of the edits were done at the beginning of 2020, which makes sense because that's when COVID-19 first became relevant to the world. And it started to decline as 2020 went on because the information and details of it started to become more concrete. And the authors of these articles started to solidify their information. So as you can see here, this is the Wikipedia article data that we gathered based on articles containing relevant to the coronavirus. And we can see that the top three are coronavirus, COVID-19 pandemic, and coronavirus disease in 2019. So we grouped them by average page views, and we decided to use this to explore how relevant these articles are to COVID-19. So the methods we use are revision history, investigation, word clouds, analysis of page views and edits, and LDA. So for the World Health Organization and Johns Hopkins, we use word clouds to group or to pull the most significant words out of these websites to see what's being talked about on there. And for the other three, we use for Wikipedia. We specifically use LDA to analyze the Wikipedia articles, which is a form of topic modeling, where we clean our data by first getting rid of certain punctuations and stop words that aren't relevant to the actual COVID-19. And then we performed LDA using, first we would use TF-IDF to group the most relevant words together, and then we would perform LDA to see which ones stood out the most to us. And then Yang will now talk about the results.
Yeah, so the following slides is talking about our results coming from our methods. The first one we are doing is the LDA on the coronavirus article. We are doing it as a whole document, and we found that the top frequent words are the coronavirus or some professional terms that describe coronavirus, which is kind of using terminology and kind of hard for the general publics. Then we compared contents for the Wikipedia and John Hopkins and WHO using the word clouds. And we have find that the Wikipedia has the most professional terms in the coronavirus pages, but the John Hopkins is more facing to the general publics with some of the easier terms like describing the new cases and public health. But the WHO is more about vaccine and also some of the professional terms like protein or virus or immune system. Then we also doing a comparison between John Hopkins and Wikipedia coronavirus project with their page view. And we found that John Hopkins exceed 1 billion visits in January 2021 to their coronavirus pages. But the Wikipedia, the whole project, they have 387 million page view combined for the top 1,000 COVID-19 articles, which is far less than John Hopkins. And we explore the reason for this by looking at the page views for some of the articles. For example, this is the page view for the COVID-19 pandemic. And we found that it reached the top at page view at the May or June, but it falls quickly as the popularity of these topics go off. So the total page view is less than the John Hopkins one. And then we also explore the edit data, and we want to find out what are they contributing and who are contributing to the editor of those COVID-19 articles. We choose 3 important articles. These are COVID-19 pandemics, COVID-19 pandemic by country and territory, and the coronavirus pages. And then we found that some of the users are contributing way more than the others. For example, in the coronavirus pages, the guest 2,625 is contributing the most comparing to the other users. And then we look into the whole graph by looking at the percentage the top 10 and the top 100 editors contributes to the separate articles. And we found that it's heavily skewed as the top 10 editors contribute almost as the same as the rest of the editors who are not in the top 100 editors. And then we also looking at the actual content they are creating by using the LDA models on the editing comments on those articles. And then we found that the COVID-19 pandemic articles has some of the responsible editors who are not only caring about formatting and the content, but also caring about misinformation and disinformation in the topic 4. But if we went to the COVID-19 pandemics and by country and territory, we can find that the editors is mostly editing about for their contents. But these go worse when to go to the coronavirus, the most popular pages, according to our previous EDA, that they are basically talking about contents, but they are also putting a lot of effort in the formatting as the topic 4, topic 8, and topic 10 are talking about those issues. So from our personal perspective, is that if the editors are putting more and more works in the typo and formatting instead of contents, then we are worrying about the quality for those kind of articles. So then we come to the conclusion.
So given all of the methods that we did, we don't think that we can conclude that Wikipedia is necessarily better than Johns Hopkins or the World Health Organization, but we can say that Wikipedia is a reliable source during the COVID pandemic. But we can't, and we also can't generalize that for being reliable on topics that aren't related to COVID. If we were to do any future studies, we would look at past pandemics, and we would also include more Wikipedia pages, articles, and edit history, since we only looked at a couple, and we would expand upon the text and citation data. And there's also other topic models with LDA that we could do in the future. Thank you for listening. This concludes our presentation.